Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 20th October 2025. This video is an American Journal of Preventive Cardiology article published on 13th October 2025 online titled Utility of Coronary Artery Calcium Scoring in Low-Risk Patients from the MESA study, the multi-ethnic study of atherosclerosis study. Coronary artery calcium scoring is an established tool for intermediate atherosclerotic cardiovascular disease risk stratification. However, its role in low-risk individuals remain unclear. This study evaluates the utility of coronary artery calcium in such individuals using the MESA data. This is a prospective cohort of 6,712 participants, mean age 62.2 years. 52.8% were women with no prior cardiovascular disease. Drawn from MESA, median follow-up was 16.7 years. Coronary artery calcium was measured by Agatston score and additionally by volume and density. Atherosclerotic cardiovascular disease and coronary heart disease events were evaluated by COX models, and predictive performance assessed by a Harrell C index and net reclassification improvement. Risk categories were defined using both the pooled cohort equation and the AHA prevent equations. What did they find? Coronary artery calcium was present in 22% of low risk and 46% of borderline risk participants. Event rates per 1,000 person years were 4.1 in those who didn't have coronary artery calcium, whereas it was double digits, 14.3 in those with coronary artery calcium. Coronary artery calcium was independently associated with atherosclerotic cardiovascular disease, hazard ratio 1.35 for low risk and 1.30 for borderline risk, p-value 0.001. Addition of coronary artery calcium to pooled cohort equation improved C index, the Harrell C index for atherosclerotic cardiovascular disease from 0.593 to 0.640, and for coronary artery disease from 0.588 to 0.667 in low risk. Key takeaways: coronary artery calcium improves risk prediction even in low risk groups and may reclassify up to 80% of individuals into statin-eligible categories. Greater gains are seen in younger patients and men. Coronary artery calcium volume and density outperform Agatston for predictive power. This is a graphic abstract from the article for you all to look at your leisure. Hit pause. Clinical pearls. Even low-risk individuals may harbor subclinical atherosclerosis detectable by coronary artery calcium. Coronary artery calcium scoring enhances risk stratification beyond traditional models like pooled cohort equation and prevent. A coronary artery calcium score greater than 0 in low-risk patients may justify statin therapy. Volume and density may offer enhanced discrimination versus a Agatston score, particularly useful in men and those below the age of 50 where relative reclassification is highest. Eponyms in coronary artery calcium risk stratification. Agatston score, developed by Arthur Agatston, quantifies coronary artery calcium via CT. The MESA study is the multi-ethnic study of atherosclerosis. It's a landmark NIH cohort study in 2000 exploring subclinical cardiovascular disease in diverse populations. Prevent equations, AHA updated cardiovascular risk prediction tools introduced in 2023. Harrell C index, it's a concordance statistics used to evaluate model discrimination. Frank Harrell is a biostatistician at Vanderbilt, and he was chair of the department of statistics. Pooled cohort equation PCE, 2013 ACCHA tool for 10-year atherosclerotic cardiovascular disease risk estimation. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.